Although it's called a gamma knife, it's actually not a physical knife. It's
Right.
it's a series of 192 beams all focused down to one point,
Okay.
highly focused, and it's got the precision of a knife. It's actually sub-millimetre precision, so
Right.
developed by a neurosurgeon historically,
Okay.
and used it as a gamma knife, like a surgical tool, can be wielded like a knife.
Okay. So many patients have surgery, neurosurgery for brain metastases, and it's quite distressing. As a radiation oncologist, I know that patients have their breast cancer treated, for example, and they may have spots in the brain. What's the advantage of, say, gamma knife over surgery?
Well, it's all case by case dependent, but generally it's a non-invasive procedure. That's one of the major things. We do have a frame that we do place on the patient's head. It is screwed in just at 4 points on the head.
Right. Is that local anaesthetic?
Local anaesthetic, it's very well tolerated.
Yeah.
And that allows us to localise or to map out every part of the brain and the head in reference to that frame. Once we have that, then we can use the gamma knife to specifically target any of those spots. The other advantage is the patients are in and out in a day, so it's an outpatient procedure. Whereas after surgery, you're generally in hospital for a few days, maybe even a week or two for recovery.
And weeks of recovery afterwards.
That's right, that's right. We're here, the next day you're back to your normal routine. You can return to work or you can go back to having a rest.
Look, I just want to rewind a bit. So the patient comes in.
Yes.
Well, first of all, the patient sends you their X-rays, or you assess whether they're eligible.
That's right. We have something called an MDT, or multidisciplinary team, where we all sit down, from neurosurgeons, radiation oncologists, myself as a physicist, nurses and radiation therapists, and assess every case.
Okay.
And if there is a benefit to using the gamma knife for these lesions, we'll then accept the patient.
Okay.
Once accepted, we book them in and they arrive at the centre. We go through a few bits of paperwork. Generally takes about 15-20 minutes.
Okay.
The frame is applied,
Okay.
and then we have imaging. We do MRs, CTs, and any other type of imaging required for the treatment of the day.
So you're basically saying, on that day I'm going to give you your treatment, I'm going to localise these 193 spots into one or several areas, but to be accurate, we can't rely on previous scans, we've got to do it, the scan again.
Generally, yes, and we do very, very fine slice, or you think about it like a high definition imaging.
Okay.
Once we have that imaging, we bring it into our planning system, and then we make a customised plan to maximise the doses to the target and minimise doses to the normal brain. And that's the real advantage of the gamma knife. So the patient, once they have a customised plan, it could vary from under an hour to maybe a couple of hours, depending on complexity and number of targets. Once we've generated that plan and 3 of us have signed off on it, the patient is then treated. Another important fact is that when the patient is being treated in the gamma knife, the treatment can be paused at any time. So if they want to go to the bathroom and they're awake, they're listening to the music of their choice, or they bring in their own iPod or something to listen to music, they'll say, hey, I need a break. We can pause the machine, they can go to the bathroom, and then we can resume, because everything's localised to that frame that we've placed on the patient.
Michael, I really appreciate you coming in today. Thanks very much.
Thank you. Thanks for having me.
Okay.